Help me pick up Jamaica, the land of wood and wine.
This presentation is an overview of the health systems in Jamaica. During this presentation, we will briefly review the description of the health systems in Jamaica, how Jamaica finances the healthcare system, and we'll look at some future prospects. Jamaica is the largest English-speaking island in the Caribbean and has a population of approximately 2.93 million people. It is categorized as an upper middle income economy and has 14 parishes. The development of primary health care can be traced from slavery, but major development was seen in the 1970s. This came out of the International Conference on Primary Health Care meeting in Alma Ata in 1978, where a declaration of primary health care was made. It was here that primary health care was identified as the key to the attainment of the goal of health for all. The provision of health care is the responsibility of the Jamaican government. The government has a 10-year strategic plan to achieve universal health coverage and access by 2030. The Ministry of Health and Wellness has oversight in the delivery of health services and is responsible for the improvement of service delivery through stewardship, human resources, social participation, and intersectoral collaboration, along with modern infrastructure. The healthcare system in Jamaica is based off a two-tiered system, that is, the public sector and the private sector. The public sector is the primary provider of primary, secondary, and tertiary health care and public health services. The sector provides about 94% of the country's hospital bed capacity, while the private sector mainly provides outpatients or ambulatory services. Jamaica's strategy for delivering primary care to the population has been centered around the public facilities and utilization of health centers for primary care and hospitals for secondary care. The provision of government-funded services is used by a large proportion of the society. The public sector consists of the Ministry of Health and Wellness and 4 regional health authorities, namely Southeast Regional Health Authority, Northeast Regional Health Authority, Southern Regional Health Authority, and the Western Regional Health Authority. To improve service delivery, the functions of the Ministry of Health and Wellness were decentralized, where the core functions of the ministry is related to policymaking, planning, regulatory actions, and purchasing, while the delivery of actual health services across all 14 parishes was left to the 4 regional health authorities. The public sector also consists of primary, secondary, and tertiary care facilities and the country's medical school. There are 2 types of health facilities within the public sector: hospitals and health centers. There are 23 public hospitals, which are categorized as Type A, Type B, and Type C. Type A provides comprehensive secondary and tertiary health care and serve as referral centers. Type B provides secondary and tertiary health care, while Type C hospitals provide primary and basic secondary care. We also have a quasi-public hospital as well. There are 6 specialist hospitals that are not classified as Type A, B, or C. There is the Victoria Jubilee Hospital that deals with women's health, the Bustamante Hospital for Children that deals with children's health, Bellevue Hospital, which is Jamaica's psychiatric facility, the National Chest Hospital, which was opened in 1940 during the tuberculosis outbreak in Jamaica, and it now serves as a place for the diagnosis and management of infectious diseases of the lung and pleural and other services. We also have the Sir John Golding Rehabilitation Center. This center was established in 1954 by the late Professor Sir John Golding in response to Jamaica's most devastating outbreak of polio, and is now the only integrated treatment and rehabilitation facility for the physically disabled in the English-speaking Caribbean. And lastly, we have the Hope Institute, which is a free hospital for cancer patients and functions as a hospice which facilitates the furthering of cancer treatment in tandem with other major government hospitals. Presently, there are 327 primary care health centers island-wide. Health centers are also categorized as type 1 to 5, offering primary care and other specialized services. The private sector supports healthcare by providing outpatients or ambulatory services, which includes 75% of all outpatient care and 5% hospital services, pharmaceutical services, and diagnostic services. In 2015, it was recorded that there were 10 private hospitals providing 200 beds in the private health sector. This number has increased since then, especially during the COVID pandemic. The Jamaican government established a public-private partnership to fulfill the objective of ensuring that all citizens have access to primary health care, with the government bearing the cost. This is a part of the ongoing health sector reform, making health services efficient and accessible to all citizens. The Jamaica's health system is financed mainly through general taxes, out-of-pocket payments, prepaid plans or health insurance, external aid, and support. As was stated earlier, Jamaica is embarking on universal health care, which ensures all individuals and communities receive the health services they need without suffering financial hardship. It includes the full spectrum of essential quality health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. The establishment of the National Health Fund, NHF, in 2003 was another step taken by the government to improve access to health care. The NHF individual benefits programs were established to ease the burden of out-of-pocket costs for pharmaceuticals through two types of initiative. The NHF card, or the National Health Fund card, provides subsidized medication for a list of 15 chronic illnesses. The Jamaica Drug for the Elderly program, or the JADEP program, provides low-cost medications for at least 10 illnesses to beneficiaries over 60 years. Jamaica has made many initiatives to achieve the goals of universal health care and access. In 1966, the National Insurance Scheme was developed, which is a compulsory contributory funded social security scheme that covers all employed persons in Jamaica under the National Insurance Act. It offers some financial protection to the worker and his or her family against loss of income arising from injury on the job, sickness, retirement, and/or death of the breadwinner. From this initiative came the National Health Fund, which was established in 2000 to 2005, which provided pharmaceutical care services starting in 2011 to date. The scope of services has now expanded to other health services, including diagnostic care. Jamaica has a 10-year strategic plan to achieve universal health coverage and universal access to health. A major move by the government to move closer to this objective was to abolish user fees for all public patients in 2008, but retained for public patients with insurance, private patients, and foreigners. In other words, it reduced the cost barrier to access primary health care by its citizens. Jamaica's private health sector is driven by profit, where patients pay for services either out of pocket or via private insurance. Jamaica's strategy for delivering primary care to the population has been centered around the public facilities and utilization of health centers for primary care and hospitals for secondary care. Whilst the private health care system is utilized by the population, the cost of health care is a barrier to access to a large section of the population, and the provision of government-funded services is relied upon by many. The government is therefore in the process of reforming primary health care by increasing funding, ensuring financial risk protection, reducing inefficiency and inequity in using resources, and to assure transparency and accountability. The strategies used to accomplish this include 1. Strengthen mechanisms to improve partnerships between the private and public sector. 2. Establishing a national health insurance for health services that allows all the population access to a basic package of care. And 3. An integrated service delivery network to link the public health department, the primary care services delivery sites, and the hospitals. Once these are properly implemented, Jamaica should be able to reach its goal of universal health care and universal access.
Help me pick up Jamaica.